I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on immunizations, why, what, and how is part of a series of videos giving information on commonly recommended vaccinations. This video is intended to supply general information. For specific decisions about your health, please consult with your personal doctor. Today, we'll consider why you should get immunizations for yourselves and your loved ones. You'll also get a basic idea of how vaccinations work and learn the benefits of risks of vaccines. For the purposes of this video, we'll use the words vaccination and immunization to mean the same thing. For information on specific vaccinations, you can go back to our website at cornerstonefpmg.com and click on the videos link to access the other videos in this series. Some patients ask why they or their children should get vaccinations. There are three important points to consider. First, the main reason that these diseases are often rare is because vaccinations for these diseases have worked well. Second, we need to understand what problems these diseases caused so we can accurately understand what the threat to our health would be if these diseases become common in the U.S. again. And finally, we need to realize that even diseases that are now rare in America can come back in the U.S. if they exist anywhere in the world. Someone with the germ could come back to our country and expose someone here who has not been vaccinated, and then the chain of disease could start. Being vaccinated is the only way to make sure that ourselves, our loved ones, and future generations, our grandkids and beyond, will be safe. Let me tell you a story from my wife Katie's family. Katie never got to know her mother's sister, who was named Gertrude. You see, Gertrude died at age 16 in the 1930s of a disease called diphtheria. She became ill with a sore throat, fever, and neck swelling at age 12. The toxins from the diphtheria bacteria caused heart inflammation. 4 years later, she died from heart failure. You've probably never heard of this terrible disease because there is rarely a case of diphtheria in the United States thanks to the use of the diphtheria vaccine since the 1950s. That brings us to the questions of present and future risks of getting a vaccine-preventable disease that's now rare in the U.S. It turns out that the Soviet Union provides a good illustration of that. In the 1990s, during the era of turmoil following the overthrow of communism, the public health system of vaccinations lapsed all over the Soviet Union. Diphtheria staged a roaring comeback, causing over 150,000 cases and several thousands of deaths. The same thing could happen in the U.S. if a lot of people failed to stay immunized to this disease. Just how do vaccines work? We recommend two websites that have comprehensive, reliable information on how vaccines work. The first is at www.cdc.gov/vaccines. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. The second website is that of the Immunization Action Coalition at www.immunize.org. This explanation of how vaccinations work is from the CDC website. Vaccines reduce the risk of infection by working with the body's natural defense systems to help it safely develop immunity to disease. When germs such as bacteria or viruses invade the body, they attack and multiply. This invasion is called an infection, and the infection is what causes illness. The immune system then has to fight the infection. Once it fights off the infection, the body is left with a supply of cells that can help recognize and fight that disease in the future. Vaccines are often made from the proteins on cell walls of the germs that cause diseases. Sometimes they are made from live germs that are attenuated or weakened so that they will cause the immune system to respond without causing disease. Look at these illustrations to better understand how vaccines protect children and adults from diseases. A weakened form of the disease germ or a protein from the cell wall of the germ is introduced into the body. The body makes antibodies to fight these invaders. If the actual disease germs ever attack the body, the antibodies will return to destroy them. Either way, vaccines help develop immunity by imitating an infection, but this imitation infection does not cause illness. It does, however, cause the immune system to develop the same response as it does to a real infection. This allows the body to recognize and fight the vaccine-preventable disease in the future. The word vaccine refers to the substance used to induce the immune response from the body, and immunization refers to creating the immune response. So the words vaccination and immunization mean the same thing. In life, we realize that things that come with great benefit often have at least some risks. For instance, having water come out of our faucets at home is very convenient. But very rarely there may be some contaminating germs in the public water supply or even in bottled water. That doesn't stop us from drinking water. Sometimes after getting a vaccine, the imitation infection that can cause minor symptoms such as a slight fever. Depending on the vaccine, rash or soreness at the site of the injection can occur. Such minor symptoms are normal and should be expected as the body builds immunity. Serious reactions to vaccines are extremely rare. The risks of serious disease from not vaccinating are far greater than the risks of serious reaction to the vaccine. Extensive research has shown no relationship between vaccinations and autism specifically. The websites of the CDC and the Immunization Action Coalition include extensive information about the risks and benefits of specific vaccinations, including copies of the vaccine information sheets. You get a vaccine information sheet every time you receive a vaccination in our office. Each sheet specific to the vaccine you are to receive has information in easy-to-understand language. What are the benefits of vaccines? Often, these vaccine-preventable diseases are difficult to treat with antibiotics when you get sick, as the damage may be done before the antibiotics can work. Diphtheria is an excellent example of that kind of disease. Or there may be no treatment available. Polio is a good example of that kind of illness. Vaccines can prevent these illnesses before they get established in the bodies of you or your loved ones. They often also prevent the spread of illness to others around you. Vaccinations can provide a great benefit to all of us.